Good morning, ma'am. I am Marifela Marilia, your nurse for today. Before proceeding to the procedure, review the patient's chart. And then, perform hand hygiene. In my case, I'm going to use alcohol. And then, provide enough ventilation and client's privacy. So, ma'am, I will just do some observation and ask you some question. Is it okay?
Yes.
So, do you have any question, ma'am?
None.
How are you feeling right now? Do you feel any pain or discomfort?
None. I am very well.
Okay. The patient appears to be reporting age. Facial features symmetric, proportionate, clean, and neat. And no signs of acute distress. Can you stand and walk a little bit for me, ma'am? Okay, you may sit. Can you tell me your full name?
I am Raniela D.
And when is your birthday?
March 17, 2002.
And what is the date today?
March 29, 2021.
Okay. The patient is alert and oriented. Gait is coordinated. Walk is smooth and balanced. Body parts equal bilaterally and sits comfortably. There is full mobility of joints. No body odor. As I observed the behavior of the patient, she maintains eye contact with appropriate expressions, comfortable and cooperative. Speech is clear, clothing appropriate to the climate. Generally, the patient looks fit as well as clean and well-groomed. After, document the findings. So, all aspects of the patient is normal since we do not observe any abnormalities. So next, I'm going to do the skin and nail assessment. So first is the skin. While doing the procedure, we must use gloves. Yes, there is no sign of edema, no abrasions or other lesions. Skin is moisturized, uniform within normal range. Normal skin turgor is present. So that's it. The patient's skin shows standard or normal signs. So next is the nails. Okay. Fingernail plate shows normal convex curvature, even and smooth texture of the fingernail and two nails. It is not bluish or purplish, but highly vascular and pink in light skin in color. The epidermis is intact and promptness return of the usual or pink color is present when I press the nails with my thumb and index finger. And all the result indicates normal sign of the nails and skin. First, from the hair, scalp to skull, and face. Now there is no lesions, scars, or hair loss, but the patient Has evenly distributed hair, no infections or infestations. And no lumps or any deformity in the scalp or skull. The skin color of the face is right. There's no signs of twitching or abnormal movement. The face is symmetrical. The eyes and ears are on the same level. Next is to test the facial nerve. Will you close tightly your eyes for me, ma'am? Then open and smile, frown, and pump out your cheeks. Okay. So what you are going to do next, mom, is clench your teeth and bite while feel your muscle here. Open and close your mouth from here. So there's no clicking sensation present. While I'm going to palpate your maxillary and frontal muscle, will you tell me if you feel any pain? Okay. Do you feel any pain?
No.
Here, do you feel any pain?
No.
So next, I'm going to check the eyes. So there is no swelling at the eyelids. The sclera is not yellowish like in jaundice. So I'm going to pull your lower lid. It's nice and pink. The eye is equal. There is no strabismus. The pupil is normal. So next, what you are going to do, ma'am, is to keep your head still and just use your eyes while I move the object. Okay? Okay, so here we go, ma'am. Just follow the object. Okay. There is no involuntary shaking of the eyes. I'm going to dim the lights. And stare up the object, ma'am. And while I shine the pen light, just don't get distracted, okay? They are both constricted and the pupil is equal in size. Next, ma'am, stare up in the distance and please don't move your head or anything and just keep it still and follow the pen light, okay? So here we go. The pupils are equal, round reactive to light and accommodate. So next is the ears. There is no abnormalities or redness, as well as the other side. Do you feel any pain in your ears, ma'am?
No.
Okay, so none. I'm going to palpate your ears and then tell me if you feel any tenderness or pain, okay? Do you feel any pain?
No.
Okay. I don't feel any masses and I don't see any lesions. Does this hurt?
No.
Here?
No.
There is no edema or redness at the back of the ears. If there is otoscope, use it to check the inside of the ears and check for abnormalities or drainage. I'm going to whisper in both of your ears one by one, then tell me what you hear, okay?
Health. Assessment.
Okay. She can hear it clearly. So next is the nose. Head back slightly. The septum is deviated and the nasal structure is visible. There is no swelling, redness, or deformity, but is pink and moist. The frontal cyanosis is below the eyebrows. Try to cover your nostril and breathe in and breathe out to the other side, and vice versa. Airflow can be heard and normal. So next is the mouth. The lips is nice and pink and they're not chapped. There's no sores on them. Please can you stick out your tongue and move side to side, ma'am? Okay. Next, will you open your mouth for me? There is no signs of any ulcers, white patches, or other lesions. Cheeks is nice and pink and don't see any sores. Tongue is moist and pink. Can you lift your tongue for me, please? I don't see any abnormalities. If there is no tonsillar enlargement, redness, or discharge, the teeth is white and there is no broken teeth. Say and the uvula is midline. So next is the neck. Please lean back a little bit. Okay. And the trachea is in the midline. There is no swelling seen. Then please move your head side to side, up and down. Okay. Shrug against resistance. Okay. Yes. Yes, the trachea is in the midline. Do you feel any pain in your neck?
No.
Okay. And there's no lump seen. I will palpate some parts in your neck, and as I do this, tell me if you feel any pain. Okay? So please turn this way. I will start now. So first, from the pre-auricular, the post-auricular, the occipital, the parotid, the jugular digastric, the submandibular, the submental, to the superficial cervical, deep down to the cervical chain, the posterior cervical, then right above the clavicle, the supraclavicular. Do you feel any pain?
No.
Okay. Next is the carotid artery. I'm gonna palpate it one by one. Okay, I do not feel any abnormalities. Auscultate the carotid and compare each side. Breathe in and breathe out, ma'am. Okay. Breathe in and breathe out. Okay. So, it is normal. That's it for today, ma'am. Thank you for your full cooperation.